This will be kind of a casual format. We're going to talk a little bit about our topic today, and then we will open it up to questions. And anyone who's here who has a question, feel free to chime in. I know all of our panel is happy to answer questions. We'll also be getting questions from our online audience, and I will relay those hopefully to the appropriate person, or I'll look at all of you and you can tell me who's most appropriate to answer it. If you have your cell phone, if you don't mind turning it to silent or vibrate at this time, that would be great. Okay. I'm going to wait a thumbs up from streaming. We're good? Okay. Okay. Well, again, thank you for being here. I'm Teresa Green. I'm a media specialist with the University of Oklahoma Health Sciences Center. And we are here today to talk about a new accolade, some honors for the online advanced nursing degrees program here at the college, and to also talk about how that program is helping address critical nursing shortages and a shortage that is expected to worsen in the years ahead as baby boomers age and the demand for health care increases. With us to talk to these topics, we have the Dean of the OU College of Nursing, Lizelle Benefield, and she will be speaking first. Also, Dr. Gary Loving, he's Associate Dean, who also has been instrumental in the implementation, creation, and ongoing use of the online programs. And Catherine Wickham has her master's thanks to the online program, and she is a nurse who can share some personal perspective of why the online program worked so well for her. So with that, I'm going to turn things over to the Dean, Dean Benefield.
Thank you, Teresa. I appreciate it. A couple talking points first. All of us know that there's an extreme shortage of nurses at the baccalaureate degree in Oklahoma and in the United States. We need, right this moment, about 3,000 nurses in Oklahoma, and we need many, many, many more across the nation. We have a couple issues. Unfortunately, we don't have enough faculty to prepare those nurses. Let me tell you a little bit about nursing. It is the most trusted profession. Why would that be? In my way of thinking, it would be because families and patients listen and trust nurses because they provide information to help with health and illness, both in hospital and at home. If you think about what you want as a family member, you want healthy family members. When you are hospitalized, you want answers to treatment questions. Nurses have the skill set to be able to respond to those questions. If and when you ever are in hospital, you want to feel safe. You want to know that the care is appropriate and professional. That is what nurses do. Once discharged or living in health at home, nurses provide insight into health teaching, into managing pain, into managing systems of care that better all of us. Think about the healthcare environment we're in right now. We desperately need navigators, clinicians, researchers, and folks who really work at the front line. We are very desperate right now for those nurses. The kicker is there are not enough faculty to prepare nurses. In addition, we can always talk about we need additional resources in terms of funding, clinical sites, but the core of the matter is that we have to have appropriately highly qualified faculty. To do that, the University of Oklahoma Health Science Center has been able to bring together some marvelous resources during the last several years that has now been recognized by U.S. News & World Report. We have been ranked among the best in online graduate programming. It's an absolute accolade, but not surprising. The University of Oklahoma Health Science Center College of Nursing clearly is housed with several other academic centers in medicine, dentistry, allied health, and all of those together bring absolutely excellent resources to the table so that our students receive the very best education. Even more we need to be able to admit more students because that kind of an environment is very rich and very difficult to find in many areas of the country. So I am absolutely delighted that in addition to our accreditation, We have many other accolades, one of which is this U.S. News and World Report recognition. I'm going to step aside and let Dr. Gary Loving, our Associate Dean for Academic Programs, share a bit about what those online programs look like, where they've come from, and how they increase access for nurses. Dr. Loving.
Thank you, Dean Benefield. I'm happy to be here to talk about our online programs. We're very proud of the online programs that we do have. Currently, we have a master's in nursing education that has been online for about the last 9 years, and so we're preparing many of those faculty members that the dean alluded to that we are in desperate need of in order to educate the next generations of nurses at all levels, and so that's one of our online programs. And then we have two doctoral programs in nursing. One is a Doctor of Nursing Practice, and that prepares advanced practice nurses to meet the healthcare needs of Oklahomans. Currently, we are preparing clinical nurse specialists and nurse practitioners at the doctoral level, with plans to expand to other areas of DNP students in the very near future, and those nurses are prepared at the systems level to provide for evidence-based practice, to be clinical scholars, to help design the next generation of the healthcare system, which is in, as most of you know, a state of very rapid transition at this time. So they bring systems expertise to the table when educated with the practice doctorate in nursing. And then the other doctoral program that we have online is our PhD in nursing, and that was the first PhD program in nursing in the state, and it prepares graduates to be clinical scholars to be scholars and provide nursing research, and to teach, also to teach the next generation of nursing students. Our online programs allow for great flexibility for our students so that they can meet their individual needs. Many of them are busy working adults with families, etc., and it gives them some flexibility to about where, when, and how they meet the objectives of their courses and their programs. We're pleased to say that the College of Nursing has been doing some form of distance education, or have utilized technology to deliver education for about 25 years. We started in the early 1990s, providing compressed video classes via compressed video between Oklahoma City and Tulsa, and then in about 1997 we began to utilize the internet to provide coursework, and have been doing internet protocol video in a synchronous format since about 2000. So we do have a long history, and a lot of faculty and staff who are skilled at facilitating technology-mediated education here at the College of Nursing. Our online programs offer a choice of full-time or part-time progression. Students are eligible to compete for merit-based scholarships, and we have a very highly educated and skilled faculty to deliver our academic programs, so we're very proud of those accomplishments. Students have the opportunity to engage with faculty and peers in a variety of ways, both online and in person. For example, in our doctoral programs that are online, there are annual intensives in which the students come on campus with their peer students and with faculty to engage in learning experiences while the rest of their curriculum is primarily online. So since many of those who are interested in pursuing advanced degrees may live in rural areas or may live in areas where traditional mechanism programs may not be readily accessible to them, the distance option and internet provides them the opportunity to pursue that advanced education. So we continue to try to meet the healthcare needs of the state by preparing the next group of nurses at each level, both baccalaureate, master's, and doctoral. And at this time, I'm pleased that we have with us today one of the graduates of our online advanced degree nursing programs, Catherine Wickham, who earned her master's in nursing education and is now a clinical instructor here at the OU College of Nursing. And so she's here to provide you with that perspective and experience as a student, and we'd be happy to answer any questions you have about our programs. Thank you. Catherine?
First, I'll just say that I'm humbled to represent the graduates in the master's degree program with the University of Oklahoma. My pathway was in nursing education, as Dr. Loving had just said, and I chose the pathway. I chose this university mostly because it's recognizable and the faculty are very well experienced in their areas and known statewide and nationwide in their field. And the online program offered me the opportunity to stay home with my 2 young children. I am from a military family and don't have a lot of help nearby, so it gave me the chance to work on my coursework on my own time and interact with other students in the online setting and earn my degree that way. So if there's any questions.
How feasible would it have been for you to go to a traditional, in the building, sit down, continue my education kind of program?
Well, with the nearest family member several states away, it really wouldn't have been very convenient. I would have had to work out a lot of childcare, and for the extensive amount of time it takes to earn a graduate degree, it's very difficult to do that for a military family.
What were the highlights to you of being involved in a program like this? Do you feel like it accomplished and met all of your needs as a student, accomplished your goals and met your needs?
Absolutely. The difference in the online education, nursing education program here was that the coursework was geared to where the student could choose which way they wanted to take their learning activities, whether they were interested in the academic setting for nursing education or if they wanted to go and pursue areas in clinical nurse and educating staff nurses. And it allowed me to actually learn that I had more interest in the academic area when I originally thought I'd be in staff education. The faculty allowed that choice in our discussions, in our papers, and we could choose to answer certain questions one way or choose to answer questions geared more towards the academic setting. And I discovered that I had more interest in areas I wasn't aware of, and it was the faculty, their encouragement, and their genuine interest in our success that really made it more engaging, and they joined in with discussions with the other students. So even though it was online, I really truly felt like I was having discussions in a classroom, even though I was sitting in my own home. Any others?
This is for the dean. Could you address how much are we playing catch up, I guess is what they want to know. How far do we need to come in terms of alleviating the nursing shortages we face today?
Okay. There are several ways to alleviate the nursing shortage, and one of which is the preparation of more students who then graduate and are successful. But there's a second piece of that. I might reference the question, the person who was questioning this, to the IOM report, The Future of Nursing. One of the 10 tenets in that report suggests that all healthcare providers, specifically including nurses, should be practicing at something called the top of your license, or the top of your license, so that if we would fully utilize the skill set of RNs, advanced practice nurses like nurse practitioners and clinical nurse specialists, we would be seeing a better utilization of their time and thus more resources to be able to be given to patient care. So I think between those two areas, we'll never catch up, but we'll be able to address the need to some degree. If I may, we are going to have to address a national model of health care before we're going to catch up with the nursing shortage. And if we are addressing a national model of health care that is more health-focused rather than illness-focused, we would perhaps be able then to use a variety of providers so that those variety of providers across nursing, healthcare, educators, physical therapists, occupational therapists, we'd be able to see, I think, a good use of care because we're addressing in a very cost-effective manner what's most important to patients is staying healthy. Living with a sense of safety and dignity during their lives. So,
Dr. Loving, can you talk a little bit about the nuts and bolts of how online education works? Is there any component that is actually hands-on, or is it all online?
Yes and yes, because there are a variety of teaching methodologies that can be used online for the conceptual, the didactic, including, and Catherine alluded to some of those, we have in many of our courses very rich online threaded discussions, so in which there are high-level stimulus questions that form the basis of the discussion, and then students provide their perspective based on experience in reading and et cetera, and the faculty question their assumptions and stimulate the discussion to go in different directions. There are media-based alternatives for online instruction, including both didactic and using video as stimulus material for discussion. In terms of the part of the question that involves practical experience, yes, in any online program, well, I won't say in any, but in our online programs, there are definitely experiential components, and usually those are conducted in a place that's close to where the students are located. For example, in our Master's Nurse Educator program, they do have requirements for actually engaging in teaching practice with preceptors in an educational setting, whether that be in professional staff development in a clinical setting or in an academic nursing program. And our students, many of them practice with faculty here, some of them practice with faculty at other institutions. In our Doctorate of Nursing Practice program, we have the what we call our practice inquiry courses, in which the students are doing practice-based projects working with both faculty and with experts in a clinical setting on answering an evidence-based practice question, whether it be quality improvement or some kind of systems question. So there is that practical component in the DNP program. In the PhD program, obviously the students in that program do engage in independent research in the form of a dissertation, in which they work with scholars both on our faculty and in some cases scholars from other institutions to conduct independent research projects. So there's definitely a practical component to the online programs.
I don't know who's best to address this, but what does the future hold with regard to online education? Is there something that you see growing and expanding in an effort to help address the shortages?
Online education has grown in not only nursing but in other fields, and probably will continue to grow. I think that the thing that students or prospective students of programs, there are several questions they have to answer when looking for a program in terms of what are the quality indicators for those particular programs, what are the experiences like in that program, and to what degree are you able to engage with faculty and other experts in the field. So online education is extremely prevalent across higher education and not just in healthcare, and I suspect that it will continue to grow, but there will be probably some new technologies that I don't currently even know about that will improve the ability of us to use technology to deliver education, regardless of what that could be. I mean, a lot of times now students use their devices, handheld devices. We use any number of technological tools in order to deliver education. So.
Might you also address that issue? Where do you see the future of nursing education going?
Sure. Yeah, we will use new technologies. Dr. Loving is absolutely correct. I think what we'll also see is that we'll use new models of pedagogy in addition to technology. At the college right now, we have an accelerated Baccalaureate of Science in Nursing program for students who have a primary degree already that accelerates students quickly through a program in about 15 months. So as we educate folks for the future, it's going to be a model probably different than what Dr. Loving and I and my faculty colleagues in the room have experienced in the past. We begin to talk about models using interprofessional education, simulated or standardized patients. The use of technology is just a vehicle for us to get there. But the reality is we have to do serious thinking as a nation about how we're going to educate for a healthcare workforce.